Understanding ADHD. Symptoms, causes, and treatments. A comprehensive guide to attention deficit hyperactivity disorder. Exploring what it is, how it manifests, and the pathways to effective management and treatment. What is ADHD? The basics of ADHD. ADHD is a neurodevelopmental disorder that affects how the brain processes attention, impulse control, and activity levels. It's not a character flaw or lack of discipline. Symptoms typically emerge before age 12 and often persist throughout life, though they may change in presentation over time. School impact. Difficulty completing assignments, following instructions, and staying organized in academic settings. Work challenges. Trouble with time management, meeting deadlines, and maintaining focus during meetings or detailed tasks. Relationship effects. Struggles with listening, remembering important details, and managing emotional responses in personal relationships. Core symptoms. A child with ADHD has inattention problem with these symptoms. 1. Focus challenges. Difficulty sustaining attention during lectures, conversations, or detailed work. Mind wanders even during important activities. 2. Forgetfulness. Frequently loses essential items like keys, wallets, school papers, or eyeglasses. Forgets appointments and daily tasks. 3. Task avoidance. Procrastinates on or avoids activities requiring sustained mental effort, such as homework, reports, or detailed paperwork. 4. Seeming distracted. Appears to not listen when spoken to directly, often described as daydreaming or in their own world. Core symptoms, hyperactivity and impulsivity. 1. Physical restlessness. Constant fidgeting with hands or feet, difficulty remaining seated during meetings, classes, or meals. Internal sense of restlessness even when trying to be still. 2. Impulsive communication. Interrupts others mid-sentence, blurts out answers before questions are completed, or makes inappropriate comments without considering consequences. 3. Always on the go. Feels driven by an internal motor, difficulty engaging in quiet activities, talks excessively, and appears to be in constant motion. What causes ADHD? Strong hereditary component. ADHD often runs in families. Twin studies show 70 to 80% heritability rate. Structural and functional differences in frontal lobe regions responsible for executive functions like planning and impulse control. Prenatal exposure to smoking or alcohol, premature birth, lead exposure, or early childhood trauma may contribute. Medical conditions. Thyroid imbalance, sleep disorders, endocrine disorder, etc. Diagnosing ADHD with clinical criteria. Diagnosis should follow strict DSM-5 guidelines requiring symptoms to persist for at least 6 months and significantly impact functioning in multiple settings. Detailed developmental history. Childhood behavior patterns. Current symptom assessment. Ruling out other conditions. Doctors look out for these symptoms. 1. Predominantly inattentive. Primary struggles with focus, organization, and task completion. Less obvious hyperactive behaviors. 2. Predominantly hyperactive impulsive. Main challenges involve restlessness, impulsivity, and difficulty with self-regulation. 3. Combined presentation. Significant symptoms from both inattentive and hyperactive impulsive categories present. Effective treatments for ADHD. 1. Medication management. Stimulant medications under doctor's prescription are first-line treatment. Non-stimulant options available for those who don't respond well or experience side effects. 2. Behavioral interventions. Parent training programs, classroom behavior modification, cognitive behavioral therapy, and executive function coaching help develop coping strategies. 3. Combined approach. Research shows multimodal treatment combining medication and behavioral therapy produces the best long-term outcomes for children and adults. Early diagnosis and individualized treatment plans significantly improve academic, social, and professional outcomes throughout life. Treatment using therapy approaches. Therapy can be useful in treating ADHD and additional coexisting conditions, such as anxiety disorders or depression. Recommended therapies include 1. Psychoeducation, where you or your child discuss ADHD and its effects. It can help your child understand the condition better, which can positively impact how they cope with it. 2. Behavior therapy, using a system of rewards to encourage your child to control their ADHD. 3. Cognitive behavioral therapy, CBT, to change the way your child thinks and behave. 4. Parent training and education programs, to teach parents and caregivers specific and effective ways of talking to a child with ADHD. Living well with ADHD. ADHD is manageable. ADHD is a treatable condition, not a permanent limitation. With proper support and strategies, individuals can achieve their goals and lead fulfilling lives. Success is possible. Many people with ADHD thrive in careers, relationships, and academic pursuits when they receive appropriate treatment and develop effective coping mechanisms. Ongoing research. Continued scientific advances in understanding brain function and developing new treatments offer hope for even better outcomes in the future. Take action. If ADHD symptoms are disrupting daily life, work, or relationships, seek evaluation from qualified healthcare professionals. Early intervention makes a significant difference.